schemes and initiatives in the health sector. Public health is a state subject, and the primary responsibility of providing healthcare services to the population, that is including women and children in rural areas and urban areas, is for the respective state governments and also the union territories. However, under the National Health Mission, that is NHM, the support is being provided to the states and the union territories. Idea is to supplement the efforts of the states and the union territories to strengthen the healthcare system. The overall aim is to provide accessible and affordable healthcare to all those who access public health facilities. Now let us see what is National Health Mission. The National Health Mission encompasses two submissions. One, National Rural Health Mission, that is NRHM, and second, National Urban Health Mission, that is NUHM. The main programmatic components include health system strengthening in rural and urban areas, and it covers areas such as the reproductive, maternal, neonatal child, adolescent health, and also communicable and non-communicable diseases. The National Health Mission envisages achievement of universal access, that is equitable, affordable, and quality healthcare services that would be accountable and responsive to the people's needs. Now, the National Rural Health Mission. The National Rural Health Mission seeks to provide accessible, affordable, quality health care to the rural population, especially the vulnerable groups. Under National Rural Health Mission, the Empowered Action Group states, that is Northeastern states, Jammu and Kashmir and Himachal Pradesh, have been given a special focus. The thrust of the mission is on establishing a fully functional, community-owned, decentralized health delivery system, and which has an intersectoral convergence at all levels. And this would ensure simultaneous action on a wide range of determinants of health, such as water, sanitation, education, nutrition, social and gender equality. Similarly, let us see the objectives of the National Urban Health Mission. The National Urban Health Mission seeks to provide health status of urban population, particularly urban poor and other vulnerable sections. It seeks to do it by facilitating their access to quality primary health care. National Urban Health Mission covers all state capitals, district headquarters, and other cities and towns with a population of 50,000 and above. That is, as per the census of 2011, in a phased manner. Cities and towns with a population below 50,000 will continue to be covered under National Rural Health Mission. This way, both rural and urban population in the entire country is covered in both the missions. Now let us see in detail as to what are the key initiatives under the National Health Mission. To begin with, there is a launch of National Quality Assurance Framework for health facilities. Idea is to improve quality of healthcare in more than 31,000 public facilities and provide a clear roadmap to states as regards the quality standards for district hospitals and primary health centers under the National Quality Assurance. This framework was rolled out in November 2014 itself. Then there is a launch of Kayakalpa, which is an initiative to award public health facilities. It is an initiative that has been launched to promote cleanliness and hygiene and infection and control practices in the public health facilities. Under this initiative, public health care facilities shall be appraised, and such public health facilities that show exemplary performance meeting standards of protocols of cleanliness, hygiene and infection control will receive awards and commendation. Then there is a launch of a National Family Health Survey. This National Family Health Survey was launched in mid-2014 in order to provide essential data and information on important emerging health and family welfare elements to track progress on key parameters and provide evidence for policy and program. Then there is a launch of India Newborn Action Plan and also launch of Mission Indradhanush. This Mission Indradhanush, which depicts the 7 colors of the rainbow, is to fully immunize more than 89 lakh children in the country. There is another important initiative in the country under the National Health Mission, that is the new vaccines. This includes approval of 4 new vaccines, namely rotavirus, inactivated polio vaccine, measles rubella vaccine, Japanese encephalitis vaccine, and it is extended to adults as well. This will significantly reduce vaccine preventable morbidity, disability and mortality rates across the cross-section of population. Another important initiative is free drug service. This is an incentive up to 5% of additional funding, which is over and above the normal allocation to the states, and this is being given under the National Health Mission, and it is provided to those states that introduce a free medicine schemes. Then there is a free diagnostic service initiative. Under this Free Diagnostic Service Initiative, which was launched in 2013, there will be free essential diagnostic services at public health facilities, under which substantial funding would be provided to the states within their resource envelopes. Biomedical equipment maintenance is another area where the states have been asked to plan interventions for a comprehensive equipment maintenance for all functional medical equipment and machinery in their hospitals and clinics. Further, there is a comprehensive primary health care. In this primary health care, including preventive and promotional health care, early detection and prompt treatment, which serves as a gatekeeping function, is given importance, and there is also secondary and tertiary care, and hopefully this reduces the cost of the care itself. 9 areas of action have been identified to make primary health care comprehensive and universal. They are: strengthen the institutional structures and organizations of primary health care services. 2. Improve access to technologies, drugs, and diagnostics for comprehensive primary health care. 3. Increase utilization of information, communication, and technology, that is ICT, which would empower the patients and the service providers. 4th, promote continuity of care-making, care-patient-centric system. 5. Enhance the quality of care. 6th, focus on social determinants of the health, which could be done by a simple research techniques. Number 7 is to emphasize the community participation and address the equity concerns in the health area. Number 8, develop a human resource policy to support primary health care. And finally, strengthen the governance, which would include various areas of financing, partnerships, and accountability. Now let us discuss the highlights of key schemes and programs in the healthcare system. We talked about Mission Indradhanush. In this, the Ministry of Health and Family Welfare has launched Mission Indradhanush, which, as said before, depicts the 7 colors of the rainbow, and aim is to fully immunize more than 89 lakh children who are either unvaccinated or partially vaccinated. They will be fully immunized against 7 life-threatening but vaccine-preventable diseases. They are diphtheria, whooping cough, tetanus, polio, tuberculosis, measles, and hepatitis B. In addition, there would be vaccination against Japanese encephalitis and Haemophilus influenza type B. That will be provided in selected districts and states of the country. Pregnant women also will be covered in this, and they will be immunized against the tetanus. Maternal and neonatal tetanus eliminated. Maternal neonatal tetanus elimination is defined as less than 1 neonatal tetanus case per 1,000 live births per year in every district. That is the standard that has been prescribed, and all the states and the union territories of India have been validated for maternal and neonatal tetanus elimination program, and that will be done before the global target date of December 2015 itself. Next is the maternal and neonatal tetanus validation, which started in 2003 itself in a phased manner. Now, Andhra Pradesh was the first state to validate the maternal and neonatal tetanus elimination, and Nagaland was the last state, that was in 2015. Now, India has achieved this validation by improvement of institutional delivery, clean cord care practices, and also routine immunization. Strategies to improve clean delivery have been included in the innovative Janani Suraksha Yojana and Janani Shishu Suraksha Karyakrama. Another important scheme is in regard to the new vaccines that have been introduced. In a bid to protect the children from more vaccine-preventable diseases, new vaccines have been proposed to be introduced as a part of the India's Universal Immunization Program, that is UIP. In addition, it has been decided to introduce an adult vaccine against Japanese encephalitis, as said before, in the high burden districts, and the new vaccines are inactivated polio vaccine, adult Japanese encephalitis, and rota vaccine. The rotavirus is the leading cause of severe diarrhea among infants and young children in the world. Each year, India loses approximately 2 lakh children, that is an estimation, to diarrhea, and out of this, about 1 lakh deaths are caused by the rotavirus disease. Then comes the measles rubella vaccine. Measles rubella vaccine eliminates measles and also controls rubella in the country. The vaccine will help reduce the incidence of congenital rubella syndrome. Child health. Child health is another important area where various schemes have been launched, and the most important scheme is the special newborn care units. In order to strengthen the care of sick, premature and low birth weight newborn, special newborn care units have been established at district hospitals and tertiary care hospitals. Each special newborn care unit provides care at birth, and that includes resuscitation of asphyxiation newborns, sick newborn, and routine postnatal care. And the follow-up of a high-risk newborn and immunization or referral services are also provided in this scheme. Another important scheme is the National Deworming, and a National Deworming Day also is being observed. Government of India, for effective deworming coverage, like many other countries across the globe, India is also endemic for soil transmitted worms. More than 241 million children are estimated to be at the risk of parasitic intestinal worm infections, which lead to impaired physical growth, cognitive development, fatigue, internal bleeding, etc. The National Deworming Day was launched on 10th February 2015. Now, in this, the diarrhea contributes to around 11% under the 5 deaths in the country, and most of these deaths are clustered around summer and monsoon seasons. To effectively address the issue, intensified diarrhea control is being implemented. The program also includes house to hygiene awareness program and also clean practice programs. Then comes the Rashtriya Bala Swasthya Karyakram. The Rashtriya Bala Swasthya Karyakram has been launched to provide child health screening and early intervention services by expanding the reach of mobile health teams. That is at the block level, and there will be early intervention services by expanding the reach of the mobile health teams at the block level. Its objective is to strategic interventions to address birth defects, disabilities, delays in deficiencies. Now, maternal health, that is Daksh program, is another important scheme under the National Health Mission. And the idea is to improve the skills of the healthcare providers and to enhance their capacity to provide quality, that is reproductive, maternal, neonatal, child and adolescent health areas. And the Government of India has established 5 national skill laboratories under the Daksh program called Daksh. These skill labs, that is Daksh, will handhold and guide creating a skills laboratories and also train state trainers. National skill labs are being attached to all the states and the union territories so that there is an optimum utilization of the national skills lab. The objectives of these skills are to ensure skilled personnel at health facilities, improved quality of pre-service training, providing a continuing nursing education and continuing medical education for nursing schools, colleges and medical colleges who can adopt the same for strengthening the pre-service teaching. Now, adolescent health is another important area that the National Health Scheme covers. Under this, there is a Rashtriya Kishora Swasthya Karyakrama. Rashtriya Kishora Swasthya Karyakrama was launched in January 2014, and it had an overreaching aim to address sexual and reproductive health, nutrition, injuries and violence. This would include a gender-based violence also, and also the prevention of non-communicable diseases, mental health, substance misuse, and it aims to cover as many as 253 million adolescents of our country. The program is guided by the principles of equity and inclusion, right-based approach, adolescent and community participation, and strategic partnership. The key components of the program are community-based interventions and also facility-based interventions, social behavior change communication, and also the intersectoral convergence. It includes a peer education program to all adolescent boys and girls. Supplementing the above program is weekly iron folic acid supplementation program. Weekly iron and folic acid supplementation program. This entails provision of weekly supervised tablets in schools for the boys and girls and also out of school girls for preventing the iron and folic acid deficiencies which manifest in anemia, etc. Further, there will be biannual provision of tablets for helminthic control. Another important area that concerns the adolescent girls is the scheme for the promotion of menstrual hygiene among adolescent girls in the rural India. In this, the adolescent girls in the age group of 10 to 19 years in the rural areas are addressed, and it is as a part of the adolescent reproductive sexual health area. The major objectives of this scheme are to increase awareness among adolescent girls on menstrual hygiene. This would increase the access to and use the high quality sanitary napkins to adolescent girls in the rural areas. It would also ensure a safe disposal of sanitary napkins in an environmentally friendly manner. Now, adolescent friendly health clinics are being developed in this context, and it is developed across all levels of care to cater to diversified health and counseling needs of the adolescent girls and boys. There are also programs for social and behavioral change communications, and they focus on interpersonal communications. Now let me show you an excerpt of video conversation of Mrs. Kiran Mujumdar Shah, who is a leading industrialist in the medical world of India. That is with Mrs. Preeta Reddy, who is Managing Director of Apollo Hospital Group. This video clip highlights future of healthcare system in India.
I think as healthcare providers, our responsibility is enormous, and I'm being simplistic, but the challenge is twofold. It's geographical and it's financial. The geographical challenge is really what, e-health or the stuff we're doing, all of us are working about, it's all about that. How do we take quality health, get to every nook and corner of the country? You can't move healthcare personnel from one corner to the other. They're simply not available. So one of the answers which has evolved now and everyone is working on...
Telemedicine.
Yeah, telemedicine is one of it.
Mobile.
Yeah, mHealth. Telemedicine has moved to mHealth. Telemedicine has moved to web-based answers. So I think to me, the sky is really not the limit. It's absolutely an enabler because a lot of things can be done from a remote location. So why should somebody travel so far?
Yeah, and in fact people are even talking about, the ASHA workers being trained to deliver primary care, and if you can use technology to train them.
It's happening. We've worked with them in Tamil Nadu, with TCS, ASHA, Apollo, we've worked together, and they've got the palm tops. So a lot of the messages are going back, hub and spoke model, there's a central station, it's giving answers back. And I think this is a model when perfected that not only India will use, but the rest of the world will emulate. And then there's the whole mHealth platform. The penetration of mobile telephone users is like, millions. More than 50% of the country have some access or the other. If you can just plug it into a mobile triaging system, just a health triaging system, so many answers are left. On one side, we're still grappling with infant mortality. But if a pregnant woman can actually be told, this, go to your nearest public health center. So to me, healthcare has to be, there are 3 P's in it. It has to be preventive, it has to be participatory, and then move to being predictive. If we can really focus on the 3 P's, we would have done a huge thing for our country. So when I say that, it has to be preventive, all this methodology to prevent the onset of chronic disease.
Early diagnosis.
Early diagnosis, all that is in the prevention piece. Then what happens is it has to be participative, because as much as private healthcare players like all of us are doing, we're working with governments, the true PPP model in the true sense of the word hasn't happened. It's evolving. I'm not saying people are not listening, I'm not saying it's not happening, but it has to be much quicker.
And there is a need to strengthen this public-private partnership model if it has to realize its full potential in tackling the healthcare challenge. Though government measures like the National Rural Health Mission have ensured some progress in improving public healthcare, a lot more needs to be done. capitalizing on financial resources of the private sector can be one way to do it.
You know, this PPP model that we're talking about, I think there's a clear recognition that the government, the public sector has a very important role to play, certainly in primary healthcare, certainly in secondary healthcare, and to a certain extent in tertiary healthcare. But I think there's also a recognition that if you really want to strengthen this primary and secondary healthcare in the villages, at the district levels, in the kind of towns and sort of tier 2 cities, then they also believe that the private sector has a very important partnership role to play in managing many of these suboptimal kind of infrastructure.
And it has to be a partnership. Because it's really speaking, it's everyone's responsibility. And you know, the suspicion of private sector doesn't really make sense, because the government needs a certain amount of revenue to be able to, meet whatever demands and commitments they have. Private sector needs it because, there's a stakeholder initiative. So I think for both of them, the end result is the same. The ask is the same. I don't see why we're working at two ends of the spectrum. But having said that, I really think that, the thought process is changing. The model's evolving of this public-private partnership. Recently, we opened dialysis centers for the government, to take care of their CGHS beneficiaries. I think it'll all go well, but it's a question of time. It's a question of how soon can both work together.
Which also leads me to one more point about using IT. Okay? I mean, there's another aspect of IT which is really about allowing us to map the disease burden of this country.
That's my third
plan before, plan better, plan your resources, your forecasting, dealing with epidemics. All this can be done.
That's my third P. That's the predictive part, So really, it can take care of your prevention, it can be participatory, and it can predict. And that's why I think, the quicker adoption of IT will actually make us better than the so-called developed nations. Because look at our cell phone technology. We're far better than them. So if India can do it in telecom, India can, some of our roads are getting even better than theirs. Our power plants are more efficient. If we can do it in our infrastructure, why can't we do it in healthcare?